Up until what age is nighttime bedwetting normal? Hi, I'm Dr. Mona Amin, a board-certified pediatrician and mom, and we're discussing bedwetting, medically known as nocturnal enuresis, why it can happen, tips on how to address bedwetting, and when to talk to your child's clinician. Let's get to it. Bedwetting, or nocturnal enuresis, is defined as the involuntary release of urine during a period of overnight sleep in a fully daytime potty-trained child, past the age of 5. So this is your child over 5 that uses the toilet just fine for urine during the day, but at night is wetting the bed or a nighttime underwear. Bedwetting is more common in boys than girls, and there can be a genetic component. If one parent wet the bed after 5 years of age, their children may have the same problem about 40% of the time. If both parents wet the bed as children, then each of their children would have about a 70% chance of having the same problem. Bedwetting is a very common condition in children. In fact, it is reported that about 10 to 15% of 7-year-olds and 1 to 2% of 15-year-olds continue to experience nighttime bedwetting. And I'm open in admitting that I also wet the bed until late childhood, so I have personal experience with this topic as well. In most cases, bedwetting is something that your child will outgrow. I did. However, make sure you stick around for this whole video to find out when it's a concern and if you need to do anything about it. My parents monitored and watched, and it finally got better. But in some cases, you may need to intervene. Bedwetting can be categorized as primary or secondary bedwetting. Primary is where a child never had nighttime control of bladder, and secondary enuresis or bedwetting is when they did have bladder control for 6 months and then started wetting at night. When looking at the reasons for primary enuresis, we can think of an issue in the bladder, pelvic floor, kidney, or brain. Most commonly, the reason is the developing connection between the brain and the bladder. This means that their bladder is telling their brain too late that they have to urinate, making a wetting incident occur. This requires physical maturity and time, which is why we see bedwetting. It's hard for some kids to stay dry for 12 hours, and why most times it does improve on its own. A child who is a deep sleeper may also have this issue. I still remember when I was a kid, I would have vivid dreams of using a restroom in my dream, and then when I woke up, I actually had an accident in my bed. Bladder size. Some children may have a smaller bladder than expected bladder capacity, or they may make too much urine while they're sleeping. Pelvic floor dysfunction could be a reason as well. Once your child is potty trained, children who hold their urine too long can often develop pelvic floor hypertonicity, which means it's a little tight. This can increase pelvic floor tone, which leads to urinary urge, frequency, and incomplete emptying. Conditions like constipation or frequent urination during the day can point to this condition, which is not the top reason for bedwetting, but a differential to consider. The causes of primary enuresis can be medical as well, and secondary enuresis is almost always something mentioned below. Some of the medical issues related to enuresis include things like bladder or kidney disease, a known neurological condition like a spinal issue, sleep disorders like sleep apnea, constipation, and emotional things like stressful events or change in routine like the introduction of a new sibling, new school, divorce, or other major life events. And some studies even show that children with attention deficit and hyperactivity disorders such as ADHD are at a higher risk for prolonged bedwetting as well. Before deciding what to do about bedwetting, we have to make sure we have ruled out any medical or behavioral conditions like I just mentioned. If your child is over 5 and still having nighttime wetting, it's important to speak to your child's clinician so we can discuss the entire history and let you know if there's anything that needs to be done. We would want to know the following: if they're having any accidents during the day, both stool and urine, if the issue is only at night, because if it's not nocturnal enuresis or bedwetting, what their bowel habits are like during the day, if they're dealing with constipation, if they have excessive thirst or urination during the day or at night, family history of bedwetting, any acutely stressful events that you can think of, especially important if it's secondary enuresis, sleep history or concerns, and any other behavior or developmental concerns. Red flags of bedwetting, which means we should see your child sooner than later, include the following. Based on your child's physical exam and history, your child's clinician will determine next steps, which may include watchful waiting and reassurance, urine testing, blood testing, imaging, and occasionally a referral to a specialist like a urologist. The key is to understand the root issue and manage that if needed. If there are no red flags, it's likely not medical and needs behavioral modifications or time. Bedwetting can be extremely frustrated. Many parents get exhausted of doing the copious amounts of laundry that occur when their child wets the bed. It is also difficult on the child as they get older because they are often ashamed and embarrassed every time they wet the bed. So what can you do? Tip number 1, steer clear of the 4 C's: caffeine, carbonated drinks, citrus, and chocolate, especially in afternoons and evenings. For some children, you may not know this, but it can cause an increase in urine production and bladder irritation. So this is something that you can limit. Tip number 2, do not restrict foods or fluids during the day in hopes of decreasing nighttime accidents. Encourage normal hydration during the day, drinking to thirst, and reminders to use the restroom. Some kids hold because, well, they're busy and excited and can have more urinary needs overnight. After dinner time, restrict liquids. Remind them of this rule, and if they ask, say that they can have some right when they wake up in the morning. Get into a good routine with your child that includes having them go to the bathroom at the start of their bedtime routine. They should not strain to pee, but this is more of a routine to empty their bladder. Some families will wake up their child to use the restroom before the adult goes to bed, but this is your decision. It's not something I recommend, as it can mean a really drowsy kid, so if it interferes with their sleep, I wouldn't do it. Tip number 3, plant the seed of positivity. Rather than being negative and stressed, be positive and hopeful. If you are still putting them in nighttime underwear or pull-ups, tell them that this is to help keep them dry. And say, try to keep these dry. Bedwetting is not a conscious choice, meaning it's not intended and is more subconscious. So by planting the seed in a positive way before they go to bed, you can help keep them dry. Remember that putting your child with nighttime bedwetting in regular underwear won't teach them to stay dry, as they're not intending to wet the bed. All this can do is mean more of a mess. Using nighttime underwear versus pull-ups can make them feel less embarrassed, but how you speak about it matters too. If your child is in regular underwear and wets the bed, say something in the morning like, "Okay, I know you will stay dry one day. Let's clean this up." Tip number 4, consider having your child aid you in the cleanup process. If your child is not in nighttime underwear and has an incident, get your child involved in changing the bedding, changing their pajamas, and cleaning themselves up, which can help encourage them to have less accidents. Do not shame them. This is a matter-of-fact situation, and say positive phrases like, "You wet the bed. I know you're going to get better. Let's clean this up together." Reduce the shame. Tip number 5, consider a bedwetting alarm. Bedwetting or moisture alarms, as shown here, is a good tool if other lifestyle changes are unsuccessful, your child is over 6, and you feel like they're feeling self-conscious about the bedwetting. Research shows that about half of children who properly use the bedwetting alarms will stay dry at night after a few weeks. These alarms buzz or vibrate when a child's underwear gets wet. Over time, because an alarm went off when they wet the bed, their brain will be trained to associate the feeling of needing to pee with that alarm going off and get up and go use the restroom, eventually not needing an alarm to get that feeling. From professional experience, these alarms have mixed reviews. I have gotten some feedback from parents saying that the alarm woke up everyone in the house but the child who was wearing it, and it really just disrupted the sleep of the entire household. Others say that it helped. It is also important to note that the bedwetting alarm can be a big time commitment and lifestyle adjustment, as it may take up to 12 weeks of regular alarm use before you notice improvement of symptoms. I personally recommend ruling out any medical issues if needed, and if not, doing more conservative measures mentioned above before considering a wetting alarm. This is because I know that a large majority of non-medical bedwetting will get better with time, maturity, and that positive planting of the seed. If lifestyle modifications aren't successful, there are short-term treatment options such as a medication called desmopressin or DDAVP. This is something that can be helpful for things like sleepovers or sleepaway camps so the child doesn't feel insecure. DDAVP comes in both nasal spray and pill forms and is taken before bed. It's important to not drink any fluids after taking it to decrease the risk of electrolyte imbalances. An additional medication, oxybutynin, has been shown to be helpful, especially in patients who do not respond to DDAVP alone and can be given in combination with that medicine. This is not a cure for bedwetting, but it is something to consider in order to give your child the opportunity to participate in sleepovers and summer camp without fear of having an accident. So it really comes down to the needs of your child. Many times my families will ask about specialists, urologists, chiropractors, or pelvic floor specialists. I personally only recommend urologists if I'm concerned of low bladder capacity, and this would be a child who is dribbling urine during the day as well, or having urinary issues during the day. As for chiropractors, there is some thought that spinal alignment and sacral dysfunction can contribute to bedwetting. Consider seeing an osteopathic physician who is trained in OMM that can treat this, or a chiropractor who is well versed in children and balanced in practice if you would like further help. As an osteopathic physician myself, it is absolutely possible the lack of connection between the brain and the bladder can be manipulated by gentle spinal or sacral manipulation. But please don't let anyone convince you to crack your child's spine to manipulate it. As for a pelvic floor therapist, this may also be useful if your child deals with constipation issues or urinary issues during the day, like dribbling or urinary frequency, and urine studies have been normal. If a child has true nocturnal enuresis with no red flags that I mentioned, I always recommend time and reassurance, but of course a good history, physical, and workup is important, and looking at how this may impact your family and your child's mental well-being. The cardinal rule here, it is very important throughout this entire process to never shame or punish your child for wetting the bed. Remember that bedwetting is not your child's fault or under his or her control. Remind family members and friends that they should not shame or punish the child or call them names or call them a baby for wetting the bed. You should celebrate your child's efforts and successes and remind them that they are capable and that one day this will get better. Plant the seed like I mentioned versus shaming, because shaming can actually lead to more anxiety and subconscious urination and prolonged bedwetting. It can be extremely frustrating when your child constantly wets the bed, but it is important to remember that bedwetting in most cases is a normal part of development. And thankfully, most children grow out of bedwetting on their own as they get older, like myself. Millions of children across the world experience it nightly. I encourage you to continue to reassure your child that what they are experiencing is normal and empower them versus shame them. Implement the lifestyle changes as mentioned above and work with your child's clinician to find a holistic approach that addresses any medical or behavioral concerns you have, but also don't overdo it. Remember, more stress, unnecessary treatments, meds, specialist visits, etc. can add more stress for the family and child that can negatively impact bedwetting. Did your child go through a period of bedwetting? What helped your child? Was it time or specific intervention? Let me know in the comments to help this community, and of course, ask any questions below. And if you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos published. I'll see you all next time for another video here on Peds Doc Talk TV. Stay well.